Hello, and thank you for taking the time to watch one of my cases that started over a decade ago. Way back in the beginning of my dental technician career, I fabricated these PFMs on 8 and 9 for one of my dental technician colleagues. But not long ago, he stopped by to show me that he is noticing a crack on one of the crowns and also that the dark root of the endodontically treated tooth started to show. Another complaint he had was the uneven gingival margin and the length asymmetry of the central incisors. A closer look at crown number 9 reveals a cohesive fracture propagated at the margin. We know that most incidence of porcelain fracture with PFM is increased with long-term survival due to cyclic fatigue. The receding margin, along with the thin gingival biotype covering the dark root and the gingival pigmentation observed on the papilla between 9 and 10, are making the tissue around number 9 appear very low in value. You see me here assessing the gingival biotype and sounding down to the bone. My measurements confirm there was no risk of violation of periodontium if I will remove no more than 0.5 to 1 millimeter of tissue. Here I'm approximating the gingival height with a piece of floss, and from the measurements I knew I would not end up exactly at the same gingival level with number 9. But patient was aware that the amount of gingivectomy on number 8 will be dictated by the biological width and the amount of existing sulcular depth. This is a taper, narrow tip zir cut burr that I usually use to cut the zirconia restorations with, but for this case I decided to reuse one and try it on these PFMs. There is a big color difference between these preps. For these types of cases there are several material options and different approaches to mask the metal post and the discolored dentin. Slight gingival contour was also done on the left central, and a 1.2 millimeter syringe preloaded with 3% hydrogen peroxide and a brush tip was used to remove the tissue tags. Because the old PFM had metal linguals, further lingual reduction was necessary and clearance was checked to ensure sufficient material thickness. Here I am finalizing the prep in a dried field, placing the margin at the gingival level using a fine diamond burr before temporizing and allowing the tissue to heal. Prior to injecting Laxatemp into the tray to fabricate the temporaries, my assistant modified the pre-op impression to compensate for the tissue loss from the gingivectomy and the marginal changes. Note how gray the prep on number 9 looks under the temporary. I knew it would be a challenge to mask the dark dentin and the metal post if I would choose to go with a full ceramic or BruxZir Anterior crown. But because the post was very large into the canal, I opt not to mask the discolored dentin or the post with opaque composite. Further removal of dark dentin from the ferrule and subsequently application of the opaque composite would have weakened the tooth even more. This is at the final impression appointment after the tissue was allowed to heal for 2 weeks. Note the thin gingiva on number 9 and how it picks up on the dark root underneath. It makes the tissue appear very low in value when compared to the tissue over the right central. After I remeasured the sulcus, minor laser touch-up was done prior to the final impression. Getting ready to take the impression, I use double cord technique with Ultra Pack 00 and 2 cord. My assistant recommended me the Fisher Ultra Pack serrated cord packer, and I decided to give it a try. I like it because it grabs on the cord and is perfect for anterior preps. Anatomical comper caps were placed and medium and heavy body capture material was used to take the final impression. There are different methods to mask the discolor prep of this tooth. Like I said, one would be to effectively make a normal color prep by using opaque composites. This allows the use of more translucent final restorations such as BruxZir Anterior or monolithic Obsidian. The other option is to leave the prep as is and use PFM or BruxZir Solid Zirconia crown. Since I left the prep as it was, I thought Obsidian Pressed to Metal would be a great choice because it will completely cover the post. However, for this try-in, I decided to also look at BruxZir Anterior. This is an outstanding, beautiful, high translucent zirconia, and I wanted to see just how much an unmasked metal post would show through. Here are the BruxZir Anterior crowns at the try-in. This was not a surprise. I knew the left central will display a low value since I decided not to mask the darkness of the prep. Obsidian Pressed to Metal turned out to be best for this situation, where I will still get some of the optical properties of the translucent material at the incisal edges and will blend nice with the surrounding dentition. But because of the low value of number 9, there was an extra step I did perform in my attempt to brighten the root below the tissue. I had my assistant use Boost and bleach the ferrule in the attempt to get the gingiva to look more pink. In the end, the Obsidian Pressed to Metal did mask the post, but there wasn't a drastic change after bleaching. Tissue still looked slightly low in value. After final cementation of Obsidian Pressed to Metal crowns, the gingiva on number 8 didn't quite match number 9, but without violating the biological width, it was an improvement from where we started. Patient did not notice the minor differences in gingival asymmetry, and he was very happy with the result. Thank you again for watching. Back to you, Megan.